Welcome to In the Groove with Dr. Acey. I am Barbara Glidden. Dr. Acey, you're a psychologist. What does that mean?
I am a psychologist, and what that means for me is that I hold a doctoral level degree in the field of psychology, and I am licensed to practice in this state. But for a lot of psychologists, that means that they do therapy, and for a lot it means that they do research. You don't have to be a therapist to be a psychologist.
Why did you choose to become a psychologist?
For me, I feel like I was born into it. Both of my parents were in the field of psychology. But I think it's something I've always been fascinated by and wanted to know more about. And I think I was one of those people among my friends that people would come to and talk to about their problems. And I wanted to know the difference between just being the friend listening and, how to really help them in a way that would be more productive.
Well, what is the difference between a psychiatrist and a psychologist?
That's a good question. A psychiatrist is a medical doctor, so they've gone through medical school or osteopathy school and done some specialization in the area of psychology or psychiatry. They can prescribe medication is the major difference. A lot of psychiatrists do psychotherapy, so they meet with patients and they do therapy just like a psychologist, but they also prescribe medication.
Well, a big question that I have is, how does somebody know when they need therapy?
That's also a good question. My stock answer is if you're questioning whether you need it, then the answer is yes. But mostly I would just say that if anybody can find the means and make a good match between themselves and a therapist, I cannot imagine somebody who could not benefit from it.
So you're saying that everybody could use therapy?
I, again, could not imagine that if somebody is questioning whether they could benefit from therapy, and also really if you find a good non-objective person to talk to about your issues, and process stuff going on in your life with, who has some training and skills, I truthfully don't think that that could be a bad thing.
So you don't necessarily have to be crazy to need a psychologist?
No, not at all. And frankly, it bothers me a lot of times when I hear that, when people think that you have to be crazy to see a therapist, or why is so-and-so seeing a therapist, or I saw them in some office, or people who say things like, I'm going to take you to a therapist if you keep acting this way.
I've said that to you about my son. You kind of went, whoa.
Well, I guess, there's a good example then. I mean, I think that that's a good example of where it's not a bad thing and it's not a punishment. I think that it's just something that can help people figure stuff out about themselves outside of their day-to-day world.
So I guess what you're saying is, if you've questioned yourself saying, I wonder if I need therapy, then they need therapy.
Well, that's sort of my joke. If you've questioned it, then maybe you do. But I do think, if I understand that there are limitations, that it's hard to find the right person, and that sometimes it's a financial issue. Of course.
Right, well, that was some of my future questions I have. My next question is, okay, so you've determined you need therapy. How do you find a therapist?
That's one of the hardest parts, of this profession and of this kind of work, is that there are people that are exceptional in their field, but not for everybody. And the relationship between the therapist and the client is, I think, the building block of the healing and of what can happen. And it's the first part is, do you find somebody based on, who your insurance can provide, who's close by, or who's the best fit? And I think you've got to find all of it.
Well, so do you specialize in a special kind of therapy?
I personally have just been drawn to working with adolescents and young adults, which is funny because I think that a lot of people, especially in my field, we sort of get drawn to a certain population. And when I first started practicing, I thought I'd really love working with young kids, really little kids. And I wasn't very good at it because I hadn't had any of my own yet. And now, even though I have, I really, in my practice, I work with a lot of teenagers, a lot of sort of adults figuring out what they want to do with their lives. And, just people sort of in normal life struggles.
So you've kind of taken on, you've chosen to give therapy to young adults. How did that all begin? Like, how did you decide to do that and to choose?
Well, I think, it's sort of, sometimes it starts off with your training. In my training, I was lucky enough to work in a clinic that had a variety of different types of clients that came for services. And sometimes people, if they're in their training situations, in any situation when you're getting a license to practice, medical doctors, and you work in different hospital settings or different clinical settings. And usually that's the population you specialize in. So there's people that work with substance abuse issues and eating disorder issues specifically.
Right, that was my next question for you. What are the different specified therapy units? In terms of being a clinical psychologist, and with my license, I can work with people with any of these issues. I don't choose to. So if I get a referral for somebody who's looking for somebody to work with their young child, or somebody with a substance abuse issue or an eating disorder issue, if that's not my area of specialization, I will say to them on the phone, that's not who I work with, and that's not my primary area of specialization, and I can refer them out to somebody else. But I can work with, it's like I'm allowed to, but I think it's more responsible to find specialists. And you don't have to have a license. You have to have a license to practice psychology, but you don't have to license to say, that's my area of expertise. You just have to have worked with that area for a while. So people build up a reputation, and they build up a caseload, and they really, people are drawn to certain areas. They've done research and trainings, and there's so much change and growth and development in people. I think that you have to find someone who holds the right license and has enough knowledge and expertise in that area. All right. Well, you know what, Dr. Acey, we're going to take a break right now, and when we come back, we'll ask you some more questions. And we'll be right back.